We started collaboration on oncology in 2009. Almost nobody was interested in those days. Luckily, we had the chance to receive an early grant in 2011, and we used that to start and acquire some stuff for the cancer registry of Addis Ababa city. It's population-based, and now we're collecting data since then. Yes, 3.05 million people. That's what's usually recommended for African countries, to have a complete collection in one big city where you have the diagnosis and the facilities of pathologists. Well, mainly it's the basic data for population-based cancer registration. That's, of course, the ICD-10 coding. That's the entity, what kind of cancer, the date. We collect the names and the age of the patients, and then they try to collect the stage, which is a bit difficult, and they try to collect data on therapy. The patient must be habitant of Addis Ababa city. One specific problem, but that's also in many other countries, is the sustainability and the funding. We hope very much that soon the government will take over the registry, otherwise you rely on short-term funding. The other issue is there is some problem of collecting all cases. Of course, there are patients who don't reach the formal health system, and also there might be a bit of a trouble of accuracy on diagnosis because the facilities are limited. And for example, like pancreatic cancer, you will never find that, but that's also a wide known problem. At the moment, it's WHO funded. It was funded from our research grant and also the American Cancer Society, which was then also through the International Agency for Research in Cancer. Now it's WHO, and we will see for middle of next year. We hope very much. They have just now finalized a national cancer control plan, and cancer registration is one part, so we hope they will take over. Yes, and definitely to evaluate their cancer control activities in many ways, yes. Well, I think it's very good and very encouraging to have the network and to see that within like 3-4 years, out of 4 cancer registries participating, now it's 26, and I think it's very encouraging to see perspectives and to put the issue on the table. It is submitted to AORTIC, and on the homepage of GloboCan you can find the data from Ethiopia. And we have found, that's a bit unique to Ethiopia, definitely breast is the number one for females. And then for males it was the colorectal cancer in our first year, which is, we didn't have any other African country like that, and we had a lot of leukemias. So more research is needed why this is the case.